The Situation Room with Wolf Blitzer, weekdays 4 Eastern.
You think this is going to work, this deal, this version that the Senate leader has come up with, that it'll get the 60 votes it needs to pass?
I think they're going to have to throw some more things off the lifeboat to keep this boat afloat. No, not as currently structured. This is still nearly $1 trillion package. We don't know that this includes the $200 billion that they're going to give the doctors for higher Medicare fees. So, no, we're still talking around $1 trillion, and the American people have a big concern here. They don't understand how something's going to cost a lot more is going to save them a lot of money in a country that's already broke.
Well, let me bring Jamal in. Jamal, if the moderate or conservative Democrats, if they like that number, $849 billion, it's below $900 billion, it's below the estimate of the House version. If they come around, if all of them support it, and those two independents support it, that's 60.
That is 60. You know, Harry Reid is known to be one of the best vote counters in the United States Senate. I think he has a pretty good sense about how to get this bill to the floor and get it passed. And for the moderates, not only is the number important, but how you pay for it is going to be very important. They're going to have to be really assured that there's not going to be additional spending on this bill. And if they can close that loop, I think that he could close their vote.
You know, can I say we just don't know what's in the bill yet, that this bill has been written behind closed doors. We know that it's massive. We don't know what new tax increases are in it. We don't know what they've accepted from the House. We don't know where the public option is going to wind up. One big talking point for them, though, that's going to be very important is that they claim that this reduces the budget deficit, which is a huge problem for them politically, $127 billion over the next 10 years. And that's going to be something I'm sure you're going to hear them talking about over and over again.
Candy.
Hey, I think it helps. I think we have to remember that the name of the game right now isn't even the particulars. The name of the game right now is get something out of the Senate so they can get it into conference committee.
So they are going to have to massage it.
And they're going to have to massage it so that it gets past the Senate, and that's a problem. It won't be this bill, but this is the framework. Largely, it will be this with, as Gloria says, we don't know what's in it, because it's not just that conservatives were worried and moderates were worried about the price tag. They are worried about the public option. They are worried about some of the specifics in it. So we'll see. But I think in the end, something will get 60 votes, and they will move it out of the Senate.
They'll throw enough off to get something, but the real political and policy problem here is this doesn't seem to bend the cost curve, as President Obama has said. They're raising taxes and cutting Medicare to pay for nearly $1 trillion in spending. This doesn't actually reduce health care costs. And guess what the number one issue in health care is for the American people? Make it cost less, not more.
They would argue with you that they're cutting Medicare, and they would say to you that in the long term it's going to reduce spending and reduce the deficit.
That's right.
But in the next political year, 2010, going into an election, there are going to be higher taxes, there are going to be Medicare cuts, and guess what? Health care costs are still going to go up, in part because of this bill. That's what's going to happen before 2010.
There's also going to be no
Would you vote for that if you're in the Senate?
There's also going to be no pre-existing conditions anymore. People are going to be able to access health care who haven't been able to get it. There are going to be some tangible things that occur before the 2010 elections. And I'll tell you what, in my time in politics, passing something is better than having nothing to run on.
Candy, the fact that, 14, 15 million people in the United States will still be without health insurance if, in fact, the Senate bill becomes the law of the land. That's not universal coverage, what we've heard in the past the Democrats want.
It's not. And looking at the president, there are some things in this bill that he campaigned against. One of them was mandatory health care insurance. One of them was a penalty if you didn't have health care insurance. So this is going to be, again, something that they can get through. And you will begin to see the public reacting to some of these things. We've already seen with the whole mammogram mess that this is going to be brought into the health care debate. So there's a lot that's going to go on between now and the time they pass this. I mean, the one thing about the Senate is they're not nearly as quick as the House, and you will hear them on that floor for the next 2 months battling.